I certainly agree with you that the results are mixed. In fact, to me, the results are disappointing, and I think to all of us who've designed programs and set up the metrics to make assessments of how we're progressing on the three major goals set out in the National Call to Action, I think there's a sense of disappointment. I think what it means to us, as in any other performance improvement, we simply now have to go back, study what we've been doing, reassess what that's been, and design programs that are going to improve the progress we're going to make the next time around. I'll start by saying if I really were sure of the answer to that question, we probably wouldn't have to have this conversation now about disappointing results. I believe that we need to make the case for the common sense of disparities elimination and for diversity in our leadership in healthcare. We just simply need to make that case more strongly. I think with the passage of time and with different events that are going on in parallel with this, I think that's going to be easier to do, but we have to find better strategies in order to be able to do that. What's going to happen as population health becomes embedded in the work of our healthcare systems and our hospitals is the recognition that disparities and variation in a much wider range of outcomes is going to become important to us. For example, today, while we obviously are alert to and pay attention to chronic disease outcomes, that's a huge part of our national healthcare budget. It's something that has tended to get less emphasis compared to various acute procedures that are done in hospitals. With population health, where we're now attempting to manage the costs of taking care of a patient over a period of time, we're going to focus very much on who that individual patient is, what are all of the factors behind the steps we need to take to keep that individual healthy. If that person is from a different culture, from the majority culture that we're dealing with in our organization, we're going to pay attention to that and try to be culturally competent in that area in order to improve that individual's health. So the short answer is yes, population health is going to drive diversity, cultural competency, a far better understanding of the need we have to understand the different cultures in our patient population, and at the same time, a recognition that a diversity not only in our workforce but in our leadership is going to be a huge asset in addressing these issues.